Hello everyone, this is Dr. Jawad. In this short video, I'm going to talk about some simple remedies that I always recommend to my patients who are suffering from hypothyroidism. Okay, so let's first backtrack on the mechanism. So we have the hypothalamus gland, which is in the brain. That's the master gland. It sends a signal, thyroid releasing a hormone, to the pituitary gland, which sends a signal, thyroid stimulating hormone, to the thyroid gland to release circulating thyroid hormone, T3 and T4 respectively. The problem happens is when the circulating hormone in the bloodstream is not being utilized. So what happens if it's not being utilized, it sends a signal back to the brain to say, hey, I need more, I need more, I need more. It's a negative feedback loop. So this is where when you get blood markers, you're going to have elevated TSH, but you're going to have low circulating hormone in the bloodstream. Okay, so again, that's hypothyroidism. So again, what I recommend is, first and foremost, ashwagandha. Ashwagandha works on the adrenal glands. The adrenal glands are your stress glands, which sit on top of the kidneys. Okay, and what happens is that when you're stressed out and you have increased circulating cortisol levels, cortisol is a hormone, it's part of the stress response. It actually shuts down the thyroid gland. So the main focus that I always recommend, let's go easy. Let's go attack the adrenal glands with ashwagandha, 500 milligrams daily. Now you could take that throughout the day. You could take that at nighttime to help sleeping. You can take it during the daytime to, again, stabilize your cortisol levels. But the main focus is that you want to lower the cortisol levels to help increase the function of the thyroid gland. Next, iodine. Now, iodine is very important because iodine is one of the special ingredients that makes thyroid hormone in the thyroid gland. Now, I always recommend about 150 to 300 micrograms daily. It's not that much. And you can find them in foods like fish, sea vegetables, eggs, seaweed. Now, the main caveat that you have to be aware of is that iodine is needed to make thyroid hormone, yes. However, if you have Hashimoto's disease, now Hashimoto's is an autoimmune disease, which means your body's attacking itself. It just so happens attacking the thyroid gland. So what happens if you're feeding the thyroid gland more iodine, the levels are elevated, which just means that it's going to be attacking it more. So beware of your iodine. Beware of taking iodine, especially if you have Hashimoto's disease. Okay. Next, selenium. Selenium too is one of those ingredients for the production of T3. Now we make two types of hormones. We have T4 and T3. T4, 80% of it is inactive, so it has to be converted to active T3 within the body. However, we do make 20% of active hormone T3, which selenium is needed for the production of T3. Now, again, I would just recommend 200 micrograms daily because also the benefits of selenium will also reduce the autoimmune effects. So that's good if you have Hashimoto's, because what's going to happen is going to lower the anti-thyroid antibody levels. So it's actually going to lower the fact that your body's attacking itself. In addition, pregnant women, it will help balance out the hormone levels with the pregnancy. All right, number 4, an amino acid. Now, one thing that I always recommend with amino acids, you take it on an empty stomach. Why? Because amino acids are best absorbed when you have nothing in your stomach. Now, this L-tyrosine, 500 milligrams twice daily. What's unique about L-tyrosine is it's one of the special ingredients, along with iodine, that make thyroid hormones. So again, if you are hypothyroid, taking L-tyrosine will help with the production. Pair that up with iodine, and now you got the ingredients for thyroid hormones. But also, it's involved with the production of melatonin, dopamine, norepinephrine. Those are all the feel-good hormones, which helps level off your brain. Remember, when you're stressed out, you burn a lot of dopamine, epinephrine, norepinephrine through the adrenal system. Increased cortisol shuts down the thyroid gland. So by supplementing with tyrosine, you're basically doing a hat trick, because not only you're producing thyroid hormones, but also you're producing dopamine, melatonin, which will help you sleep. Okay? So next, Number 5, fish oil. Fish oil has numerous benefits, a lot, too much to really list right here. I recommend at least 1,000 milligrams daily. Now, the two things that make up the fish oil, EPA and DHA, again, they lower the risk of thyroid symptoms, helps with anxiety, helps with depression, helps with IBS, Crohn's disease. Also, too, the essential fatty acid family is good for not only for thyroid function, but basically brain function, because our body, mostly our brain, is mostly made up of fat. So remember, if you're chronically stressed out, if you have hyperthyroid, stress, increased cortisol causes brain inflammation. Fish oil will help decrease the brain inflammation, increase the thyroid function. Next, vitamin B complex. The whole B complex family is phenomenal for the nervous system, okay? And particularly vitamin B12 and thiamine. Thiamine is B1. It's important for, again, neurological function. It's also good for hormone balance. Okay, so again, Hashimoto's, the autoimmune disease that attacks the thyroid gland. Taking B complex will help stabilize that hormone imbalance. Probiotics. Now, probiotics, again, it's one of those supplements. The reasons to take are numerous. And I always recommend at least 50 billion. Now, again, when you take probiotics, some people say take in the morning, some people take in the evening. I recommend always in the evening before bedtime, because that's when the parasympathetic division of the nervous system is activated, that rest, digest, and repair. Okay? It helps heal the gut. If you have leaky gut, don't forget, if you have chronic inflammation, you're tearing up the mucosal lining of your stomach and your GI system. So again, it's going to help with the gut. It helps aid in nutrient absorption. One of the functions of the thyroid gland is to break down food products to absorb the nutrients. If you have a poor gut mucosal layer, then you're not absorbing. So probiotics is phenomenal for that. In turn, it'll help reduce inflammation, systemic inflammation all over, brain inflammation, your stomach, your gut. Again, it'll help absorb the nutrients that you need to help increase the thyroid function. All right, so again, this is just 7 off the top of my head. Hope you enjoyed the video. Please hit the like button down below, subscribe to my channel, and I'll see you in the next video. Be good. Hello everyone, this is Dr. Jawad. Hey, over the last couple of years, my YouTube channel has grown tremendously, and I can only appreciate it, the viewers who subscribe. Now, if you're watching this on YouTube, please hit the subscribe button to get the first up-to-date videos, or you could always Google my name, Dr. Jawad, and you could go to my JDoc Real Minute page. Again, if you hit the subscribe button, you'll get the most up-to-date videos. And thanks everybody who's watching. I greatly appreciate it. Thank you.